Hi, Dr. Hizon, here to talk about documenting for the patient on a geriatric wellness visit. So as a disclaimer, please refer to your particular doctor, as this is a general course not intended to be medical treatment, and your particular situation may vary. So understand, when you see a geriatric patient, the provider has to understand that it's a multidimensional, multidisciplined assessment to evaluate the older person's functional ability, physical health, cognitive and mental health, as well as their social environment and their circumstances. Most assessments are less comprehensive and more problem directed. So most of these assessments are less comprehensive. We're going to look at functional ability, their physical health, as well as cognitive and mental health. So in the testing, it's physical exam, lab work if necessary, and then referrals and additional testing if indicated. The assessment differs from a standard medical evaluation by emphasizing functional capacity and quality of life. The complete assessment is usually initiated when the physician detects a potential problem, such as confusion, falls, immobility, or incontinence. So the plan, we're going to do a lot of counseling and preventative risk, medications as needed, referrals as needed. And we're going to look at lifestyle screening, such as their medication usage, exercise, diet, and fall and osteoporosis risk. And if prescribed, there'll be medications as well as follow-up with the specialist. So in documenting for the geriatric assessment, usually it's a 90-year-old male presents today for geriatric wellness evaluation and screening. This template would be going through as a 90-year-old, so Mr. Jones is a 90-year-old male, presents today for a wellness exam. And we'd go through all of the different screening tests that they may be going through. There's quite a few: sleeping habits, depression tests, health status, developmental tests in terms of gross motor, fine motor, cognitive. And then, are they using complementary or alternative medicine? How about their tobacco use, alcohol use, other drug use? Any signs of abuse or neglect? And then, are they sexually active? Changes in their daily living and activities of daily living, such as their hearing, using the facilities in terms of the bathroom, both urinary as well as fecal, balance, and then to do a psychosocial evaluation, developmental risk evaluation, make sure they're up to date for their immunizations, and health risk behavior assessment. We'll go through the usual past medical, family, social history for tobacco use, exercise, nutrition, sleep, have they gained or lost any weight since the last visit, and go through your usual review of systems. On the examination, we'll decide if they're in moderate or severe distress. Are they ambulating? How's their affect? Do they have normal cephalic? Like, is their head normal? Do they have tenderness to palpation? And we'll go through the usual full examination. And genitalia is as indicated. Sometimes they'll do that, sometimes they may not, so you document that, as well as going through the usual template. And then on the assessment and the medical decision making, you have to decide, is this a complicated or a simple, straightforward examination and evaluation of assessment, and they'll give the rationale and reasons for the treatment. So it's usually a encounter for general exam is a Z00.8. You might do another one for a Z01.89. So on the plan and the treatment, it'll be patient education. We might use medications. We'll follow up with primary care or with specialty. So in terms of pearls and pitfalls on the geriatric assessment, be sure to document changes both physical and mental in the geriatric patient. Be sure to document all treatment in the past year, as well as illnesses and disorders, family history, as well as chronic medical conditions. Learn the various questions and questionnaires that are used in this, and please ask your doctor if you have any questions about the geriatric wellness exam. And in primary care, be sure that you've documented and ask about the quality measures, which are preventative medicine measures. So takeaway points: the exam is about prevention, so it's a preventative health screening. Not every appointment requires a head-to-toe examination. The exam counseling depends on the patient's current health, so they direct it by that. The physical exam depends on the older person's functional ability, cognitive and mental function, and the social, economic, or social environmental circumstances. So learn all of the different screens that are done by physicians and providers for the geriatric patient. So in summary, again, it's important to help the provider because while doctors save lives, medical informatics specialists and scribes save doctors. Thank you.